This also, I think it will give me access to share my screen.
Yes, actually, I'll be sharing it because of the orientation thing, but I'm giving you the co-host control so that you can share it after
Yes,
I'm
yes,
done.
yes. Right, right, right. Can you just put a message in the group that they can start joining in because it's already
Yes,
5:56.
yes. Hello, everybody. I hope I'm audible and my screen is visible.
You're audible, but your screen is not visible to me.
All right, I'll try screen sharing again. Is it visible now?
To me, it's not. but it's showing that the screen is being shared.
Yes, the same thing is being shown to me.
Now
Is
it's visible.
anybody okay?
Now it's visible.
Okay, perfect. I would request everybody to please come on camera if possible. Thanks a lot, Shivani. Hello.
Hello.
A lot of people, but nobody's on camera. It would be much appreciated if you guys could come on camera. I'll be starting with the orientation. So a very warm welcome to each one of you, and thank you for taking the time to be here today. So before we jump into our CBT session, let me ask you something very honestly. You've enrolled under nurture counseling, but how many of you actually know what nurture counseling does? Anyone of you aware on what nurture counseling does?
It does offer counseling sessions at like prices which are affordable.
Right, that's part of it,
Yes.
exactly. Okay, and I'll be giving a more detailed brief on what we do. So moving ahead, Nurture Counseling is a mental health organization focused on providing ethical, compassionate, and professional support. We work with people who want to understand themselves better, both academically, like you guys, and emotionally. And we do this through evidence based practices. So, a big part of our work is also about breaking the stigma around mental health and making these conversations more accessible and grounded. Everything we do here is guided by responsibility and ethics, both for our clients and for the people learning and working with us. So, to give you some context about our work so far, we have conducted more than 25 plus certificate training programs. We've hosted 20 plus webinars and workshops addressing real world psychological challenges and trained 1,500 plus psychology students, not just across India, but internationally as well. So, what you're entering today is a system that's been tested, refined, and built with student needs in mind. Now, Nurture Counseling is MSME registered, it's Startup India registered, and affiliated with international bodies like the American Psychological Association and IAOTH. Now, why does this matter, you may ask? Because in a field like mental health, where ethics and legitimacy are everything, it's important to be associated with a space that meets professional standards. Nurture does not just do one thing. We work across counseling and therapy, as mentioned by Shivani. We also provide psychoeducation, online support, community engagement, therapy in regional languages, therapist supervisions, and one on one mentoring sessions. So it's a very holistic setup, not just client facing work, but also training, mentoring, and community based mental health. Now, the person guiding today's session is Ms. Pratima Das. She's a senior clinical psychologist and an RCI licensed clinical psychologist with over 7 years of experience in the field. Her expertise lies in child and adolescent mental health clinical assessment, psychotherapy, and behavioral interventions. She is also highly skilled in delivering evidence-based therapeutic approaches along with experiential learning sessions. So you're definitely in very experienced and capable hands today. Okay, coming to our free student counseling support, we offer this to the age group of 18 to 24 years. So you're free to select any date between February to March within 9 a.m. to 9 p.m. time slot, whatever works best for you. To our mental wellness products. So our journals and mindfulness products are designed to help people build daily emotional awareness. If I may ask, how many of you are here into journaling and have tried art therapy? All right, that's great to see, Shivani. Is anybody else into journaling here? Okay, Nikhat, that's good to know. So for the people who did not respond, I'm assuming you've never done it before. So our 1 month journal is great if you're just starting out. And for the people who have done it before, our 3 month journal is focused on deeper reflection and habit building. So this would be more suitable for you. And the mindfulness art book helps regulate emotions more creatively. So for people who find verbal expression difficult, this might be the thing for you. Lastly, so just to clarify something that many of you usually ask us about, your certificates. On successful completion of this program, all participants will receive a digital certificate from our end. However, if any of you would also like to receive a hard copy, that option is available as well. There will be an additional fee of 300 for the printed certificate, which covers printing and delivery. So it's completely your choice. Digital is included and hard copy is optional. Lastly, you will find all our platforms here, our website, our Instagram, LinkedIn, and YouTube. This is where we share updates, resources, and announcements. So I would strongly recommend staying connected. And I'll end by saying thank you for choosing to be here, honestly, because whether this program becomes a small step or a major turning point for you, we genuinely hope it adds value. And we're very excited to have you as part of Nurture Counseling community. So now before we wrap up, does anyone have a question or any expectations they would like to share?
I would just request everyone, just to, if possible, kindly switch on your videos that we can see each other and, interact in a better manner. If there is no major issues, then we can just, interact in a video mode. Okay. I hope that I can take from here, right?
Absolutely, ma'am. You can take the
Okay.
stage. Thanks a
Thank you
lot.
so much. Thank you so much for the introduction of mine as well. Uh, so everyone, before starting my session with you on CBT, as we are going to go for a long journey, we are going to stay together for a month. We'll be learning together. I'll be learning things. You will be learning things, and we'll be sharing things. So before that, just let us have a quick introduction of everybody, that we all be on the same plane together before heading on. So first, I can see in my screen Alisha Sharma. Ma'am, can you kindly please introduce yourself? You may just unmute. It will be wonderful if you can switch on the video as well, so we just can interact. So what I am basically asking is that what are you currently doing, and what are you looking forward in the CBT session? What is your expectation? The reason behind joining the course. Yes, yes. You have unmuted yourself, please.
Ma'am, my name is Alisha Sharma and I'm pursuing Masters in Psychology from Government PG College Sector 1 Panchkula. And
Okay.
one of my friend recommended me about this session and I was really intrigued and interested in doing this.
Hmm.
This is my first session, so I'm very excited and looking forward to many more.
Yeah. Thank you so much. Thank you so much. Okay, Anisha, I can see you. Please, ma'am, unmute yourself. If possible, kindly switch on the video as well and introduce yourself.
Good evening, ma'am.
Good
Uh, my,
evening.
my name is Anisha, and I'm doing psychology honors from Punjab University in Chandigarh. And like the what I expect from this seminar
Mhm.
and this internship is that to learn more about CBT, to dive into CBT and like unlock all about it. Because
Right.
in our like in our classes we don't get into these therapies. We just learn about disorders and all that, just
Hmm.
basic psychology. So I am expecting to learn more about CBT.
Right, right. So very basic things you are learning, so you want to delve into the depth, right? Um, so where are you coming from? Where are you staying
Ma'am,
currently? Okay, Mohali. And Alisha, where are you staying currently?
I'm Panchkula.
Okay, okay. Chalo, asking of this question because how much it's possible now to connect from everywhere across the country and even beyond that. Just trying to know that. Yes, Patima, ma'am, can you just unmute and introduce yourself?
2, 3.
Hello, am I audible?
Yes, you're absolutely audible.
So my name is Fatima. I'm from Kerala, and I did my masters. I'm currently I'm doing I'm in a training session for institute for maternal counseling.
Mm-hmm.
So I think it's been 2 months. So I think the necessity to know more about CBT is a must. So I same thing. Everybody I expect more into the more than basics.
Right,
I
right.
expect more into the insights of CBT. Okay,
Right.
so happy to see all connecting across the countries. It's something exciting.
Yeah, it's really exciting even for me that connecting with so many people from so many different geographical location, and we all are together. So it's a feeling of unity, across diversity. So like it's like that. So you said that you are working on maternal counseling. You said okay,
I
okay,
just started. I just started only.
okay.
I'm in
That's
a
quite
training
interesting.
session.
Okay, that's quite interesting. Thank you so much. Asha Devi, I think this uh have we have we met before or something like that? Asha Devi, ma'am, can you just introduce yourself?
Good evening, ma'am.
Good evening, ma'am.
Good evening. Ma'am, my name is Asha Devi and I'm from Kalka.
Hmm.
And
Okay,
I'm pursuing, ma'am, MA Psychology from Government PG College, Sector 1 Panchkula. And
mhm.
मैंने आपको पहले कभी नहीं देखा, just मुझे किसी ने recommend करा, that's why I'm here to see you.
Okay, okay.
And this is my, really, ma'am, this is to be very honest, this is my first online session.
Hmm. She must be having a lot of expectations. Hmm. Okay. Um. Okay. Okay. Thank you, ma'am. Shagnik, I can see Shagnik now. Shagnik Mukherjee, if you would kindly. Ashana, kindly mute yourself as of now.
Hello, I'm audible?
You're absolutely audible.
Yeah, so I'm Shagnik. I just recently, in 2025, I completed my master's in applied psychology. And now I am looking forward for certification courses to gain more deeper knowledge in therapy field. And that's why I choose this field particularly. Yeah.
Right. So from where did you complete your master's?
Yeah, I completed from Sister Nivedita University, which is in Kolkata.
Okay.
I am
Right,
from
right.
Kolkata, yeah.
I know, yeah. Okay, okay. So you're looking for the same thing, the further depth and knowledge,
Yes, yes,
right?
yes. Yeah.
Okay, thank you.
Thank you.
Avni, yes, yes. I can see now Avni. Avni, can you just introduce
Hello,
yourself?
ma'am. I
Whoever
am
is there,
from.
just
Hello.
just allow me 1 minute. From National Counseling, whoever is there, kindly mute yourself. Otherwise, it's echoing. As of now, if you can mute. Thank you so much. Yes, Avni, please.
Hello, ma'am. I am from Chandigarh, and I am in my final years of bachelor's, and I'm doing my bachelor's in psychology honors BA. And the purpose for joining this internship is mainly to just enhance my knowledge and learn something apart from college syllabus, to have a
Yes,
deeper learning.
right. everyone is almost here. Whoever we have so far spoken with are for all practical knowledge and things like that. Because most of the time in colleges and university, we keep learning theories and theories. Uh, right. Shivani, please unmute yourself, ma'am. And I would request everyone kindly keep making your videos switched on that we can, see each other.
Hello,
Yes, please.
ma'am.
Hello.
Currently I'm working as a development coach as per like school counselor in a
Mm-hmm.
school here in Mumbai.
Mm-hmm.
And the reason why I chose this course is just to add on to the knowledge more into, like you said, practical way. Because
Mm-hmm.
theories we all know we have studied in bachelor's, master's, and everywhere.
Yes.
But maybe the way where we will learn more into practical side. Also, that will help me in my job also. And honestly, it is a plus one on the CV.
Yeah. Yes, yes, true, true. That if you have a certification course, it will be adding something in your CV, right? So you're working as a school counselor and you want to, get further knowledge in CBT. Okay, thank you.
Yes,
Na-
ma'am.
okay, okay, thank you so much. Nava, I can see now. Can you just introduce yourself? Okay, I'll be reading then later.
Hi, I am I
Hi.
audible?
You're audible. You're audible.
Actually, I am traveling back home from my office. A little network issue I'm facing,
Mm, okay. So you're also
and
in, are you working as a counselor only? Yes, organizational psychologist you have written. Okay. Okay.
yes,
Fine.
I'm working towards employee experience and development and policies and well-being.
Mm.
And
Okay.
my aim to organization is get practical and education
Yeah. Okay. You want to apply this CVT knowledge in your organizational setup, what I'm getting
of
from. Yeah. Okay. Thank you. Thank you so much. Jivita, sorry. Very sorry. Jivita, can you just introduce yourself, please, ma'am? Miss Jivita. Okay. If you're not here, you can introduce yourself later as well. I can see next.
Yes,
Okay.
madam.
Yes. Please.
Hello, madam. Good evening, madam.
Good evening, ma'am.
Gita, I have done my MPhil in applied psychology, madam, and
Okay.
I want to know more about CBT, and I'm looking for openings in jobs. So I
Mhm.
just want to explore more, and I have taken this course, madam.
Okay. Okay. So, ma'am, your applied psychology MPhil, you must have done long back, no?
Ah,
Because
yes, yes,
nowadays,
madam.
the MPhil is only available in clinical psychology. Hmm.
Yes, madam. Yes, madam.
Okay. Okay. Great, ma'am. Uh,
Thank you.
Next, I can see Rilang. Rilang, can you kindly introduce yourself?
Hello.
Hello.
Oh,
Hi.
can you hear me?
I can hear you. I can hear you.
Okay, okay. Everyone, and hello, ma'am. My name is Coach Rilong. I am a rehabilitation counselor, and the reason for joining this course is to understand more in depth about CBT and also to be more well trained in conducting CBT, guiding CBT.
Okay. Okay. You're working as you said,
I
as
am
an
a
organization
rehabilitation counselor.
rehabilitation
Yeah.
rehabilitation counselor.
Yes,
Great.
yes.
So many diverse, diverse kind of work everyone is doing in the same field. That's wonderful to see. Okay. Thank you so much. Next, I think I can see Nikhat. Yes. Nikhat, can you kindly introduce yourself? Yes, please.
Myself, Nikhat. I'm from And I'm pursuing my master's in clinical psychology.
Okay. And you're looking forward to, ma'am? What is the expectation from the course?
Learn more about CBT and
Okay, ma'am, your voice is breaking. Next, I can see Arika. Arika, kindly introduce yourself to every one of us. Yes, Arika.
Hi, good evening, everyone. Good evening, ma'am.
Mm.
So, I am Anika, and I am currently in my last years of psychology honors bachelor's from ST College, Chandigarh.
Mm-hmm.
And how I ended up here is that I really wanted an exposure to therapy. Like, I'm really into, further trying for clinical psychology. So, I wanted to know more about CBT. So, this is how I ended up here.
Right, right. Thank you so much. I can also see Arika. Anika is there, Anika Oberoi, and Arika is also there. Arika is there. If you're here, then Arika, ma'am, kindly introduce yourself. Okay. Okay. If you're here, if you come back later, kindly introduce yourself. Then I can see now, Truth Pule, if I'm pronouncing it correctly. If not, then kindly, just let me know the pronunciation. Yes.
Hello, good evening, everyone.
Good evening.
My name is Truth Pule. Pule is the surname, but you can just call me Truth. That's okay.
Okay.
I am currently studying in India, in Trivandrum, Kerala. I'm a psychology student, bachelor student in my final year. I'm here because I want to be work ready. So I was like, let me try and get more practical kind of skills, more training, and just for professional development. Yeah.
Great. So where do you belong from, Truth?
I am from a very small country in Africa called Botswana.
Okay. So it's wonderful, no, that we all are here together and we are sitting across the country, and some people even belong from, not even, beyond the country, and we all are together. It's really wonderful to see this board. Okay. So next I can see is Good Shift. Good Shift. I think you are only left to introduce yourself. Can you kindly do that?
Everyone as well. I'm Gurshit Kaur. Am I audible?
You're audible. Yes, absolutely.
Okay. So I've just completed my graduation in psychology honors only, and I've learned French as well during my graduation. And I want to pursue masters in counseling psychology. So I want to get the practical experience. So I thought this program would give me much more overlook and the briefs and the details of the CBT program. So I opted it to get the practical knowledge and to see in a experimental way how the things are there, except for the theory part.
Right,
So yeah, that
right,
is why I've enrolled in this.
right. Okay, thank you all. Almost what I
Thank you
have
so
seen,
much.
a common factor, common expectation in all of you. That is that all are looking for practical skills, what you can, administer on your patients, on in your practice, you can use. So you are looking for that. So as we are in the very beginning, as it is day one, of course, the whole course have been, I have built it like that only. It will be a lot of practical skills you will be getting, will be learning. Um, but as today is the very first day, some theoretical foundation is needed there before going into the core practical setting, just to know the CBT better, that what we are going to do we will be getting the theory of the practical. Okay, but it's not theory per se, just to read the theory, but to delve into the theory, delve into the practical portion, the some portion of theory, whatever we need to know, we'll be talking about it today. And from tomorrow, of course, we'll be getting into tools and all the practical things. Okay, so I'm just starting with it. I hope my slide is visible and I'm absolutely audible to you all.
Yes, ma'am.
Okay, thank you. So you can see the syllabus, right? That what we are going to cover. It mostly divided into 8-9 module. So I hope that my number 2 slides is also visible. Whenever I'm asking a question, kindly unmute yourself and say, because I can only see my screen now. I'm unable to see you also. It's very difficult to track if you're just writing in the chat box or something like that. Just unmute yourself and say that you can see what we will cover slide number 2. Is it visible?
Yes, ma'am.
Yes.
Yes, ma'am.
Okay, thank you so much. So the module 1, what we are going to cover is about CBT, history and beyond, because we have to know that what we are going to do, how will it be in test, what all ingredients it's required. So these all things, need, because even before cooking, we need all the ingredients ready, right? So just before we start cooking from tomorrow, we just need to get all the ingredients today. So we are going to do that, the module 1 today. The next module will be on cognitive model and conceptualization, along with hands-on practice, which we will be starting from tomorrow actually, because this model and case conceptualization is the very crucial part in CBT. If you cannot do that, then we cannot go into cognitive strategies, behavioral strategies. There is no use of it. Even after learning, you will be unable to use it if we do not know that how to make a CBT model and conceptualize each cases. Module 3 will be on core cognitive strategies. There are multiple cognitive strategies, so we'll be going into that, which is a bit, I would say, it's a big, it's a big portion in CBT. Along with that, behavioral strategies, there will be also doing the role play and all these things. So that also is a chunk of a portion. These all things are. The next module, the 5th module, will be on CBT treatment planning. That practically how you can do this treatment planning of your patients and whatsoever. Module 6 will be focusing on mainly, again, I have repeated this, just sorry, don't go to modules. Module 6 will be the 7th one. So it will mainly be the application of CBT across concerns along with case discussion. Here we'll be doing the case discussion part and how across all the concerns we can use CBT. And then the next one will be therapist skill and your self-reflection. And the last, of course, all these outcomes, we will be summing it up and, all these things. So let us start with some portion of the theory of module 1, which is very important to know before going into CBT. So CBT, I would say practice. Before going into that, it's very much required to know. Before starting it, again, I'll be reminding you, if you want to say anything, if I'm not audible or any problem is there, kindly just unmute yourself and say, because I'll be unable to see as I am now getting into this and only the screen is visible to me. So how did cognitive psychology emerged? So you must have heard of Edward Tolman. So Tolman is the pioneer of cognitive psychology. Though you have heard of Aaron Beck, just before I think 2 years he passed away. Before that he was alive, and there is a Beck Institute of Cognitive Psychology is there also. But Tolman also had a crucial role in cognitive psychology. And from where did this cognitive psychology emerged? Because in 1950, when there is several waves of therapy. Like we know the first thing was Freud's psychoanalysis, right? We all know that Freud's psychoanalysis were there. And right after that, whoever even are doing graduation, they can relate. Like we have started this in graduation only, that after psychoanalysis, actually behaviorism, comes there. There was a movement of behaviorism and all this conditioning, classical conditioning, operant conditioning, all these things have had come up. But after that, in 1950, there was again a revolution. And then cognitive psychology come up, because behavior we can only see. Because whatever Skinner and other behavior therapists say, that whatever we can see, we need to judge based on that. We need to observe the behavior. But what is beyond the behavior? What about thinking then? Because in separate situations, we all react and we all do our actions differently. So from where it is coming? Is it only about behavior? So from where the behavior is coming? It is shaped by our thought, our higher order cognitive functioning. So from there only cognitive revolution have been started in response to behaviorism. And then the cognitive model actually originally constructed by, of course, Aaron Beck. There are several studies and researches of Aaron Beck, which is mainly after 50s. In 60s, he has done a lot of research, especially CBT. Aaron Beck have first applied on depression, the cases of depression. Because in depression, we have seen that it's not only about behavior. Aaron Beck, have just in his several research, he tried to show that depression is coming from some cognitive framework, some schema. This is coming from that. It's not only the behavior. Even if it is the behavior, even if some biological thing is getting associated with that, like sleep, appetite, we have seen weight loss, weight gain, whatever is there. But all these things are somewhere connected with our thoughts. Now, Aaron Beck and Albert Ellis, they have shared a view that after their research, both of their research, they have viewed it in a way that all the psychological disturbances, not just depression, arise from a faulty cognition or faulty cognitive processing. Cognition is there. It's not only about behavior, it's not only about past experience, what Freud said, but it's also about a cognitive processing, our entire cognitive framework. There is always some negative thoughts. Anything, even a small stress. Why am I stressed? Why my heart is beating faster? Why my palm is sweating? All these things, from where it is coming, it's coming straight from my head. That means it is coming from my cognitive framework, cognition. So they have said that. Now the thing is, after this, now CBT have shown that this is the strongest evidence based of all psychotherapies. Though I'm very, I also do practice mindfulness. Even I do collaborate both of these therapeutic modules. But CBT till now is just beside mindfulness, because it's it's the next wave. But before that, CBT is the strongest evidence based of all therapies or all psychotherapies. And it is an evidence-based therapies. You can use it. There are several research of it. There is no doubt in using CBT, and anyone, even if you use it on yourself, it will give benefit. And we'll do it on all of you in the session. And you will see that some amount of change, at least I'm very sure, I'm very confident, at least 5% of change after 1 month, of course, will be there. Right? If you can use it, if you can utilize the tools you will be gaining from here on yourself. Now, the vast majority of this research related to implementation of CBT is generally on anxiety and depression, several spectrum of anxiety disorder and several forms of depressive disorders that we have mostly seen, because from there only the treatment got started, the CBT approach. There are many randomized control trials in CBT where we have seen that it is equivalently working and effective, just like medication for management of any psychiatric disorder, any psychological disorder. Just like the medication, it is equivalent, CBT. Because psychiatry has two things. One is functional, one is structural. That's why even while we do neuropsychological tests, even IQ test, any other neuropsychological assessment, whenever we do these things, what happens, that we cannot just based on our functionality of our brain. It's about sorry, not only the structural things, we also need to see the functional part of it. So this functional part can only be treated by therapies, because the amount of neurotransmitter, amount of serotonin maybe needs to get increased. All this SSRI group medications are there, but those all things are making your chemicals in a proper portion, adequate portion, in the baseline, which it is supposed to. It is supposed to, my serotonin is supposed to be in this certain amount. So the SSRI group medication is just doing that. But what about my cognition? How will I change my thought without the therapy? So it's just like that. That's why both are needed. So after even follow up, we have seen that relapse is less in case of CBT. If you use the therapeutic CBT method, then of course relapse is less, because if we use only antidepressants, again it is just making the proper baseline of chemical substances in our brain, but it is not working on our thoughts, not on our emotions. So how it is going to affect on my behavior if I just withdraw the medication? It's not possible. So that's why the therapy comes into play, and it's a higher response rate is also there in CBT. So that's why it has slowly become gradually, now we can say that CBT is evidence based and you can use it. Here you can see in this graph that when we are giving CBT alone, medication alone, the effect on our patients is the same. It is, the improvement is 50 to 75%. But along with the medication, when both are combined, actually the efficacy is even better. But there are certain conditions, there are some mild condition, moderate condition, even some moderate condition actually, where medications are not required only. You can start with the therapy and can see that how much they're improving. Now there are a few principles of CBT. We'll be going into principles now. Just before that, I'll be asking if there is any question until now. Okay, if there is no question, I will be going, I'll be then going back to the
Ma'am, the question is a bit off topic. Just wanted to ask that क्या हमें screen recording मिलेगी video की or the PPTs?
Yeah, you will be getting the PPTs and the video is already been recorded.
Okay, ma'am.
But
Thank you.
75% attendance is mandatory for your certification.
I know that. Hanji.
Okay, fine. So now we'll be going into the principles of CBT. So in CBT, the first principle is you have to know the principles, because based on these principles only will work. Whatever we do, whether it is case conceptualization or cognitive strategies, behavioral strategies, whatever it is. So CBT is based on a formulation of patient's problem and individual conceptualization. It is not a generic thing. That's why I said that we first need to know that how to conceptualize a case, how to form a CBT model. Because if we can do that, then only it will be based on individualized patients. It's not a generic thing. Now, the next thing is it's about therapeutic alliance. You and your patient should be having a very good alliance. Like you need to be on the same page because both need to work here. There is no hierarchy in between patient and the therapist. So you need to have a very sound therapeutic alliance. How to create the alliance? I'll be coming after this. Now, principle number 3 is it's about collaboration and active participation. It's nothing like your patient will be a mere observant or a mere follower of whatever you are saying. But two of you will jointly work. You will be even creating a session goal together. This is needed in CPT. So that's why the collaboration is needed. Principle number 4 is it is very goal oriented and it is problem focused. Even when we will be creating goals, we will be seeing that what the current problems my patient is facing. Based on that, we will be creating goals. It is totally goal oriented. It is not based on too much past or on other things. It's just goal oriented. It will be creating goal and it will be solve it. Just work on those goals. That's why people do take CBT, because CBT is not as lengthy process that it will never be. It's not a never ending process. It has a perfect framework. Now the next is CBT initially emphasizes the present. Of course, it goes to past, just like psychoanalysis. There is a part where it will go into past, but initially it starts working on the present scenario, present problem. So based on that only, in the present scenario, we first make the goal, because we need to make our patient functional, our client functional in the very present moment. Principle number 6 is CBT is an educative approach. So there are many therapeutic, I would say, there is many, different kind of therapeutic module. Some are reconstructive. There are some reconstructive therapy, like psychoanalysis is not educative. It is a reconstructive therapy. CBT is a re-educative therapy. And there are also some supportive therapy. Along with supportive therapy, we do also use conjunct therapy like art therapy, dance therapy. So just like that, CBT is a re-educative therapy. It is re-educating your thoughts and emotions and all these things. Now, so it also emphasizes about relapse prevention. Before ending the session, we do focus on relapse prevention. And CBT is, of course, I already told, CBT is time limited and it is very much structured. You will be having a proper framework in order to work with CBT. And this framework is concerned with an introductory part, a middle part, and a final part. I'll be discussing that later while I'll be giving you the treatment plan, how to do that. Then you will be getting to know that whenever you are going to take a session with your client, there are 3 parts. It has been divided into 3 parts. One will be the introductory part, one will be the middle part, and one will be the final part. And the next is CBT teaches patients to identify, evaluate, and respond their dysfunctional thoughts and belief. Here, actually, we'll be teaching the patients only that how to identify their dysfunctional thoughts, because they are not going to. We don't want, a good therapist never want their patients lifelong to depend on himself or herself, on their therapist. They need to know that what are my dysfunctional thoughts, that they can work there. They will be respond to it. You will be guiding. They will be responding to it. So that's why we will be teaching. That's why it's an educative method, educative therapy. And that principle number 10 is there are a variety of techniques to change the thinking, mood, and behavior. So techniques only we need to learn that how to change your thinking, mood, and behavior. So the next part, there are different parts of CBT and there are different forms of CBT. And in these forms, actually, of course, we know that this is cognitive behavior therapy. So CBT, cognitive behavior therapy. But actually, uh, there are, like, after behaviorism, when behavior therapy comes up, it has come up separately after psychoanalysis. So there are separate behavioral strategies. It is not always mandatory that you have to club both the approaches and you have to do both. So the one more, I would say one more pros to learn CBT is that you're also getting to learn the behavioral techniques in it. So you're also getting to learn behavior therapy. So you can individually use the behavioral strategies, and behavioral strategies can wonderfully work even on children. So behavioral strategies you can separately use, cognitive therapy you can separately use cognitive strategies. And after a while our Albert Ellis, the pioneer of cognitive therapy, I already told, Baig actually clubbed it, cognitive behavior therapy, and it has come up as CBT. That both are needed. Behavior also need to be changed, but how? By thought. So this way, you also might be knowing about RABT, rational emotive behavior therapy, which is all this, strategies and tools are mostly like CBT only in RABT. Just the stance is different. It's a bit direct approach. It's a bit, I would say, uh, empathy is somewhat differently viewed in RABT. So it's a bit direct approach. It's directive as well. So RABT is that. Now problem solving therapy is a distinct part of CBT. Here we learn the problem solving techniques as well. So if some people just come up with a certain problem, in their life, like if you get a case, suppose maybe somebody just before their exam has come up to you because they're unable to focus in exam. You can simply use some CBT techniques without delving into deeper things and without asking them to take a full CBT session. Within 2 sessions, 3 sessions, you can just cover up this. If somebody come up with some relationship issues, some conflictual situation, that I want to go to abroad to study, but I also want to stay close to my family or friends or whatever loved ones. So what to do? All this in conflictual situation. Maybe somebody has come up only with one situation. They has come up to you in therapy just to solve a problem in their life. You can simply use the problem solving techniques of CBT, and you don't have to use everything, every sort of cognitive and behavioral strategies. Exposure therapy is also there, especially exposure prevention therapy, I would say, which is particularly for OCD clients. It is also actually a form of CBT only, ERP. But the thing is that it's a different kind of measures. It's a bit different. It's particularly for OCD only. There are also third wave CBT. That means mindfulness has been clubbed with CBT, like MBCT, mindfulness based cognitive behavior therapy. So if you later go into mindfulness, it will be also easier because you already get to know a part of it, CBT. So M will be added, right? And multimodal therapy is also there. Like in any therapy, sometimes like if you're treating somebody in addiction, there are particular therapy for addiction, MET, motivational enhancement therapy. With that, you can club some process of CBT. You can club something, you can take something from mindfulness based therapies. So it can be clubbed, and it is called eclectic approach, right? So multimodal therapy in multimodal therapy also CBT can be used. Now the uses of CBT, most of the people actually do think that only in mental health concern we can use CBT. Anxiety, mood disorders, even there are CBT for schizophrenia. Just like OCD, it's a bit different, but some strategies are similar only. So for schizophrenia also, it does work wonderfully. I have used on my patients. It can also be used in eating disorder, post-traumatic stress disorder, in case of addiction. So all this mental health concern can be solved, can be treated with CBT. That we all know. But what else? There are physical health concern as well. Like somebody from who have diagnosed with some life-threatening disease, some terminal illness, like maybe AIDS, maybe with though nowadays AIDS are not terminal illness, but it's a shock. Actually, it's a transition in your major transition in your life. You have to adjust. Somebody might be asking to take chemotherapy. So coping with this physical health concern, CBT can work wonderfully. That's why in many, I would say mostly all hospitals, in their particularly, they're having a psycho-oncology department. So in oncology department, they are actually hiring psychologists who can give CBT to the cancer patients. In chronic pain, CBT works wonder. Uh, any new diagnosis, I have already said, chronic fatigue, insomnia. So in physical health concern like insomnia, sleep problems, it can be used. CBT can be used. Apart from that, there can be some lifestyle issues as well. Apart from mental health concerns, if we keep aside physical health concerns as well, there comes some lifestyle issues. Like if some person is having assertiveness, they're not enough assertive. They have difficulty saying no, and that is a major problem in their life, that is hampering the social communication, and that is also affecting their confidence. So just by using some strategies of CBT, you can help them. So it's a lifestyle correcting therapy as well. In case of diet, maybe someone is in diabetes, but due to insulin surges, they have craving for sweets. Or maybe somebody is already into binge eating and they have been recommended not to maintain a strict diet, but they are unable to do. What you can do with medication? Nothing. We have to change our thought, we have to change our emotion, we have to have a better coping mechanism instead of just eating. So in case of diet, one wants to just having just a problem, maybe some one person come up to you and say that every day I think like to start dieting, having a healthier life and start exercising, but I'm unable to motivate myself. So in this case also CBT can be used. Social isolation, grief. If somebody any grief, losing a job, then death of a near one. So all this thing, breakup, divorce, any major transition in life, which is followed by grief, CBT can be used. Anger management, pure anger management, there is nothing, you can use CBT. So in various spectrums, so CBT can be used, not only in mental health concerns. Now, the therapeutic alliance, how to build that, the therapeutic alliance. So, of course, like most other therapies, these are the core thing, 5 core thing you have to keep in mind: empathetic, understanding. You have to be warm, which is this. There is lack of warmth in RBT. I don't know personally. That's why I'm unable to connect with RBT. Though most of the techniques are similar, but warmth, your warmth and empathy, what we can basic. This is a basic thing we can offer our patients. These are required. The genuinity of the therapist. That you are not keeping anything under the carpet. You are not beating around the bush. You are showing electrons, and you both are working together. And this is direct but sensitive. It is not direct and harsh. It is direct and sensitive enough. Okay. So this approach, actually, if you're going to be a CBT practitioner, you have to keep in mind these 5 things. It will create your therapeutic alliance with your patient. Good. Now, we'll be starting a certain portion of module 2, which will be further more interesting tomorrow, because we are going to do some activities. Just to give you an introduction of module 2, that what is cognition? Can somebody please say what is cognition? Can somebody just unmute and say what is cognition? Anyone, just try. You all know.
It involves higher order.
Mm-hmm. Yes, ma'am, go ahead. Higher order.
It involves it involves higher order thinking skills and mental processes.
Right, right. Exactly. Absolutely. So, cognition is that mental processes, gaining knowledge, comprehension, all the higher order functioning. Right. So, these all things are there. Now, this is the CBT thing, because the CBT model, basic CBT model, we'll be learning to create it. It is as for look wise, it's very easy, but when you will be how to take how to ask right question to your patient and how to get through it, we need to know that. Now, CBT is actually all about changing your perception. If cognition is about higher mental processing and knowledge and thoughts, then CBT is about changing the perception. So it's a cycle of thought, emotion, and behavior. And it's a correlation between all these three things. Thought means what we think. Now, how we think does affect how we feel and behave, how we act and feel. Whatever we'll think, it will be affecting our behavior and emotion. Same for emotion, same goes for emotion. What we feel, it will affect our thinking pattern and our behavior. Like, I'm feeling sad, but what makes me feel sad? If I look into that, I'll be getting track of my thought. And that's why I'm behaving in a certain manner. Maybe that's why I'm crying. So this is the act. Now, behavior also do affects the thought and emotion, and it's create a loop. So it's about changing perception. Now, I also have given a sample example just to make it easier to understand. Suppose, just see this triangle. This is called triangle of CBT, triangle of CBT model. So the thought, the feeling, the behavior. If the feeling is, suppose if the feeling comes first, that I am feeling low and depressed. So what is making me feel low and depressed? What is the thought? I have let everyone down. They will be angry with me. I'm not a good friend. What is the behavior? Withdraw from others, avoid friends. Okay, so this way we can connect this triangle, CBT triangle model. Another example, I feel anxious. Or maybe even you can start from the thought, I can't do this. What is wrong with me? Everyone is looking at me. Maybe somebody is having social anxiety and having all these thoughts, uninterrupted thoughts. What is the feeling? Anxious. What will be the behavior? Of course, withdrawal. Ignoring, escaping the situation, get away from the situation, and avoiding the particular situation in future. So this is the CBT model, basically. Now, what I want you to do, everyone, I want you to do, so this thought, feeling, and behavior is coming from a situation, just like if I go to the previous slide, if somebody is having, stage fear, then stage fear is the situation. From there, this feeling, thoughts, and behavior is coming. That I'm feeling anxious, I can't do this. What is wrong with me? These all things, and from that only the behavior is coming. So the basic thing is the situation. So just like that, for tomorrow, I want you all for yourself. Okay, just search one situation, thought, feeling, and behavior of yours. Okay, any negative thought, you can start with even thought that what negative thought I'm getting nowadays. It's common for all of us. Nobody can say that I don't have any negative thought. I do have, you do have, we all do have. And if we count from morning until now, at least once today, if we just consider today, we felt bad. We had some negative feeling. Even if we were in a party, in a gala party, still we felt At some point in a day, we felt low, a bit something else, angry. So some negative emotions we have felt. So basically, just try to track your thought and what do you do then, behavior and situation. Uh, just come up with that. So it will make us, easy to get into further things. Right? Any question, anyone? And are you getting that what you have to do tomorrow? That from there we can start.
Ma'am, so as we discussed, CBT is educative, right?
Yes.
So is it, can I say, is it bit directive also?
Yeah, it is directive. I have shared no in the previous slide. It is directive. It is directive approach, right?
Okay.
It is direct. See here, it is direct. The therapeutic alliance only is direct, genuine, so that is okay. But there are actually um, three types. It's not type actually. It's the module of therapy: reconstructive, supportive, and re-educative. So there was some supportive therapy. It's a different spectrum, different module of therapy. There are some reconstructive therapy, like psychoanalysis. It is reconstructing all these things, your schema, your past experience in the present scenario, all these things. And CBT is re-educative. We are re-educating our clients, so we are changing their perception. Did you get it?
Yes, ma'am.
Okay. Any more question, anyone? Just before closing, I'm asking. I'll be, of course, sharing the PPT with you, and kindly make it, okay? Kindly have one situation, thought, feeling, behavior. It will be interesting to do. And I would recommend a real thought. And one more, I think, rule we should be, though we are on board and we have started, flying. But I just want to make one simple rule, right? Well, cabin crew always told us that there are so many rules. So we also should be having one rule that whatever will be discussed here will be here. We are not going to share anything, whatever in this house we are going to discuss. We are not going to judge anyone here. That all can share their personal things openly and in a safe environment. I think this we can do because we all are from psychology background, so that we can work on ourselves. CBT we can apply on ourselves. Until and unless we learn that, it will be we cannot use on anybody else. Okay, so this is the onboarding rule. I hope all are agreeing with me. Like all are ready to, just to maintain this rule. Okay. If there is no other question, then we can close today's meeting. And please come up with this. Don't take it as a homework. Take it like anything I will be asking you to do at home. No, don't take it as a homework. Okay, it is self-exploration that you learn yourself better. So do this self-exploration and let us again take you to further depth tomorrow. Right? Okay. Okay. Thank you all. If there is any more question, even you can ask tomorrow.
Thank you so much.
Thank you all.